Welcome to the Diabetes Awareness Assembly. My name is Gracie, I have type 1 diabetes and we're making this video to explain it.
Type 1 diabetes is an autoimmune disease that starts to attack and kill the insulin-producing beta cells in the pancreas. It's not a contagious disease, so don't worry about catching it from Gracie.
My name is Garth Braithwaite. My daughter, Grace Braithwaite, she was diagnosed with type 1 diabetes July 1st of 2014. And she was with her mom. They went to the doctor. The doctor saw high glucose in the urine and so sent them to the hospital.
And at first I thought it was contagious and then I had to be locked up in a closet. But then I asked my daddy and he said it wasn't. I used to get stomach aches every morning. So then a couple months ago I got diagnosed with celiac too. So I have two autoimmune diseases. Autoimmune diseases means that it's a disease that's not contagious and I have to eat special foods, not with diabetes, but with celiac I'm not allowed to have gluten, and with diabetes I have to take insulin. So I have a pump and a Dexcom. The Dexcom helps read my blood sugar.
There are ways to manage type 1 diabetes, and we do that every day with Gracie. Her range is between 80 and 200. If she ever hits 100, we have an emergency dance party, and that's pretty awesome. Anything over 200, the CGM becomes inaccurate, and we must poke her finger. The same thing happens if she goes below 80.
Hi, my name is Jamie Braithwaite. I am Gracie's mom. Everybody that's a type 1 diabetic has one of these. Very important. And you test your blood anywhere from 8 to 10 times a day.
My name's Emmy and I'm going to show you the stuff to poke my sister's finger. First, clean your skin. And then get your finger poker and then poke your finger. Get the tester. She's a 106.
If she's over 200, these are signs of hyperglycemia, and it takes approximately 2 hours to bring her down from a high to get the insulin working in her body. Low blood sugar is a very dangerous situation. Your brain needs glucose to function, and when Gracie's BG is below 80, she does not have enough glucose to function. So we check her finger with the finger poke. We treat it using carbs such as candy, sugar, juice, and then we wait approximately 15 minutes and we check her blood again to make sure that she's coming up. What's your name?
Ashford.
How old are you?
3.
And what's in there?
Candy.
What is it?
Candy. Gracie's message.
Starburst?
You're not Starburst. You're message.
How many carbs are in a Starburst?
1, 2, 3, 4.
Say hi, Jameson. Smile.
We have a lot of technology that helps. We're sort of nerds at our house, and so we really do like all the technology that is available.
I'm Ainsley Braithwaite and I'm 8 years old, and Gracie is a type 1 diabetic. Because she's a type 1 diabetic, she needs super cool gadgets to keep her alive. What she has is the Dexcom. There's a tiny wire that goes into her skin that reads her interstitial fluid. Interstitial fluid. Right now, Gracie is 127.
Her Dexcom is a continuous glucose monitor, so it's kind of like poking your finger every 5 minutes. But this device has to be within 30 feet of Gracie. So what has happened is Night Scout is a foundation and a group of people that have got together, and they've created a way for us to use a cell phone to upload the data so that it's in the cloud. So we have the data in the cloud, and my favorite thing in all the world is my watch. On Gracie, these are the temporary tattoos that we've designed, and we usually put it next to her Dexcom or her pump site so that she doesn't have to explain every time someone looks at her arm. She's able to just say it's a medical device. On this side is her pump.
There's a site that's connected to her skin, and there's a little tube that the insulin goes through to connect to her pump. The pump has insulin in it and is called the T-Slim. So when Gracie wants to eat carbs, she has to put it in her pump.
Her pump, she wears a belt, especially when she's wearing a dress. But this is what gives her insulin. And the insulin is in this cartridge in the back. And it goes through the tube, out her shirt, and into this infusion set. She also always wears a medical alert bracelet and tattoos and stickers and all that kind of fun stuff.
My mom has a really cool website that is called DUND Club.
What happened is we had all this technology, but we didn't have any way to indicate that it was a medical device. So Grayson and I got together and we designed some stickers for all of her technology. So if somebody finds this, they're able to call us and return it. So that's the technology that Gracie uses.
I'm pretty happy that I got diagnosed with diabetes because it helps me feel better and that I can actually fit in with other people and not be worried and just be comfortable around people, because I used to be super shy, not like to read, but since I got diagnosed with celiac and diabetes, I've been able to read better, understand things better, and be more comfortable around people. My name is Gracie Braithwaite, and I was diagnosed. I was 8 years old, but technically I was 9 because it was a couple days before my birthday. Welcome to World Type 1 Diabetes Awareness Day.